I like to present my PhD thesis, which is New Insights in the Treatment of Partially or Completely Edentulous Patients. I am Yasir and Mohammed, a dentist from Iraq, first year PhD student at Center for Translational Medicine. My supervisor is Gabor Varga. My vision is to provide the patient with long-term, successful, and comfortable prosthesis, and my mission is to investigate the recent evidences concerning implant abutments and fixed and removable prosthodontics. According to that, I have two projects. The first one is comparing the long-term success of zirconia, PEK, and titanium implant abutments, which is a systematic review and meta-analysis, started September 2023. The second one is that, which is also a systematic review and meta-analysis, which is investigating the efficacy and safety of added soft liners on removable prosthodontics. Regarding the first one, it is a meta-analysis and systematic review, which started in September 2023. Well, according to the Foundation of Oral Rehabilitation, in 2020, there is maybe 240 million people in the US which is partially or completely edentulous. And whenever a patient has the choice, the fixed prosthesis is preferable. So approximately there's maybe 500,000 individuals in the US having implants annually. So there is a compound annual growth rate of about 5.7% from 2020 to 2030. Now, one of the components of implants is the abutment, which is the connection between the fixture and the prosthesis. The gold standard is made of titanium, which other materials may be used, like gold, alumina, zirconia, and others. Now, titanium is a ductile, durable material, biocompatible, but has disadvantage, like the gray color, which is anesthetic, especially in the anterior area, and with thin gingival biotypes, may have titanium surface release, which may predispose to inflammations, and it has a higher surface roughness compared with zirconia, and we'll see PEK. So zirconia may be used as an abutment. This is also a biocompatible material, more tissue-friendly, white in color, more aesthetic, but it is a solid material, so once force exceeds the proportional limit, this will cause a fracture, and has no ductility. On the other hand, there is a polymer, a synthetic polymer, which is white in color, called PEK, polyether ether ketone. It is used as removable denture, a framework, a clasp, and may be used as an implant, but in orthopedic surgeries. It is a biocompatible material, and it has a modulus of elasticity resembles that of bone, which is favorable in case of stress and fracture resistance. Also, it has a surface roughness of less than 0.2 micrometer, which is less than titanium, which is favorable for the antibacterial adhesion of bacteria like Streptococcus oralis. So we want to aim to compare the long-term success of zirconia, PEK, and titanium implant abutments in clinical practice. According to that, our question is, what is the performance of zirconia, PEK, and titanium implant abutments? The P is the patient with implants. The intervention is either zirconia or PEK abutments. The control is titanium abutments, and primary outcomes is a biological outcome, which is the most important: bleeding on probing, bone loss, pocket depth, survival rate. Secondary outcomes may be color changes, aesthetics, and soft tissue response. Our hypothesis is that zirconia and PEK are non-inferior to titanium implant abutments with better aesthetics. Our clinical implication is that we want to improving the durability, function, and aesthetics of implant-supported prosthesis. We did a systematic search, and maybe started in 2nd of November, and 4 databases in base Central, Medline, and Scopus. And this is our search key. We have multiple articles, some of them comparing zirconia, PEK, comparing 3 of them, titanium versus PEK. We choose only randomized control trials with multiple follow-ups, maybe 13 years, 7 years, 5 years. Each study has also limitations, like different periods of time, so we have to do subgrouping or regional measurement rather than average. So also we did subgrouping, like distal, mesially, or the average outcome measurement. The total number of studies was more than 11,000, and after duplicate removal, it was 5,788. And after completion of the article and abstract selection, it is 144. So we started Prospero on the 19th of November, and then the second day, 20 November, we started duplicate removal. The result was 5,788. Title abstract selection was done by me, co-investigator, and then this agreement was solved by the third person, resulting in a total number of 144 articles. And now I am started the Prospero full text selection, which may be 10%, 14 articles done. Regarding the second one is the investigating of the efficacy and safety of added soft liners on removable dentures. It is also a systematic review and meta-analysis. Now, there may be more than, in the US, more than 36 million individuals which is either, that is completely edentulous, according to the a study done by Lee et al. 90% of those having complete dentures. 50% of those renewing their dentures annually. Now that is because the frequent tissue changes underlying the dentures called the residual ridge resorption, and this requires frequent relining to regain the relationship with the underlying tissues and the opposing occlusal surface to improving fit and comfort and retention stability of the denture. Now, soft liners are part of lining materials, which is have additional advantage of shock absorbing effect and that is cushioning effect, that is flexes and compresses under load to provide a stimulation effect and shock absorption. So our aim is to investigate the efficacy and safety of added soft liners on removable prostheses. Our clinical question is that does the addition of soft liners and removable dentures improve mastication and acceptability of the patient? So the P is the patients with removable dentures. The intervention is that dentures with liners, the addition of soft liners, and the control is that there is no addition, and the outcomes is pain, inflammation, fitting, and durability. Our hypothesis is that soft liners improves the fitting and durability of removable prostheses. And our clinical implication is to improve the fitting, retention, comfort, and durability of removable prostheses. We done a preliminary research in 3 databases. We found some key articles, and there is no previous meta-analysis, and there is an ongoing systematic review registered in Prospero. So we are in the stage of checking the feasibility of the topic. And according to that, my aim is that I will be able to submit the first article maybe in June 2024, and the second one in September. And I'd like to finish my presentation with a quotation by Pascal Manier, which may be the godfather of biomimetic dentistry, which is said that in prosthodontic and restorative treatment, our primary goal is that biology, and then biomechanics and function, and finally aesthetics. So aesthetics, it is a result of our good work rather than it is a priority. So thank you very much.
I have a question regarding your first project. How do you think that systematic diseases, which may decrease the wound healing, will influence your project or maybe your inclusion or exclusion criteria?
Most of these are related to the placement of implant, which is the fixture, rather than the abutment. But I think that diabetes may have an influence on the abutments as well, regarding the soft tissue response and healing. So maybe zirconia is more tissue-friendly than titanium. But PEK, we are investigating, but there are research that it may be functioning for 5 years with no difference compared with zirconia.
How can you control the several factors? It's not just systemic disease, but other factors which can influence the survival rate of abutment or the implants, like width of the attachment of the gingival, attached gingiva, or even the general oral hygiene. Do they measure in the clinical studies which you?
Mostly, no, they didn't like checking the influence of these factors. But there are like they checking the all soft tissue response, like for example the biofilm, adhesion of bacteria, inflammatory responses, MMPP8, enzymes presence with regard to these type. But regarding systemic problems or medical problems, there's no such investigations.
So the studies doesn't contain this information. That's basically you cannot collect them.
No. Just like let's say control.
Is there any split mouth study, like putting PEEK in one side and putting titanium on the one side, because that would be the most feasible trial?
There are articles comparing PEEK versus titanium, and there are comparing PEEK versus...
Yeah, but it's in the same mouse, so it's a split mouse study. So they are putting on the same patient, one side titanium, one side zirconium, or what?
Sometimes they are placing in the same patient zirconia and titanium, and sometimes like providing patient with zirconia and this patient with titanium.
If there is any possibility in statistics terms that you can weight it more, those studies which has split mouse, because most of, if you have enough, like at least 2 or 3, I would make a subgroup analysis just for the split mouse study, because that's the only way to control those systemic effects.
Yeah. Okay. Like there is, I think most of the studies are split mouse techniques.